For the first time ever, the number of fentanyl-related deaths in our state more than heroin-related ones. It's impacting the most people in Baltimore. ABC 2 News' Skylar Henry spoke to those dealing with the epidemic of what they call an alarming rate and how they're trying to stop this problem. Skylar.
Yeah, Jamie, new numbers released just Friday show the number of fentanyl-related deaths have more than doubled in the last year, killing more than 120 people in the first 3 months of this year alone in Baltimore. The people who see the addiction firsthand tell me the rate of deaths here is troubling. In a city that's in the midst of an epidemic of violence, there's another crisis: fentanyl. The numbers at first glance are staggering. 123 fentanyl intoxication deaths from January to March of this year in Baltimore, a third of the fentanyl-related deaths in the state.
So even the patients have no clue what substance that they're using, how toxic it is, and how fatal it is.
Fatalities, Marion Curran says, that are skyrocketing. She wears multiple hats on the front lines of the heroin and fentanyl crisis at the University of Maryland Medical Center's Midtown campus. The state health department reports the number of deaths from the fentanyl in the first quarter of the year are the highest they've been in 10 years. It's a problem impacting decision makers and those who see the epidemic firsthand, like Curran.
This past weekend, another patient who was seemingly doing well had a mishap, died. Needle still in his arm, left a wife and 2 young children.
It's why Baltimore City Health Commissioner Dr. Leanna Wen wants to take a holistic approach to the problem, saying a quick fix won't patch the state's gaping wound.
If we're unable to treat all those people, we're going to continue to fuel demand, which is going to continue to fuel the supply of drugs, too.
Baltimore, as part of federal and state funding, will receive more than $20 million to fight the heroin-fentanyl problem.
We have done a lot with limited resources, including I issued a blanket prescription to every resident in the city for the antidote medication for naloxone or Narcan.
A step in the right direction, Dr. Wen says. Still, those at UMD, like Laisha Gardner, who go into the community to help those battling heroin addiction, say there should be more ways than naloxone to help. But it starts with those who need it.
If you bring your body, your mind will follow, and the will to get treatment will follow. I believe that's true. If we just kind of show up, then it'll come.
Now, in addition to naloxone and access to treatment, Baltimore is creating a stabilization center. That's a 24-hour resource crisis center for those battling heroin and fentanyl addiction. That's scheduled to open up next year. Jamie.
All right.